The PIP implants were manufactured in France for about a decade, and they were an approved implant. And it wasn't until about 2010 that the French authorities discovered that the man who was running PIP had actually been using a different kind of silicone to the one that was on his license. That we know for sure. So he should have been using medical grade silicone, but he wasn't. He was using cheaper type of silicone, which, because it wasn't medical grade, is automatically called industrial grade silicone. And he did that purely for financial reasons. But nobody knew about it until early 2010, when the French authorities raided the factory, closed it down. What happened at that point was that there was a worldwide recall of PIP implants that hadn't yet been implanted. And then a testing program was commenced to find out whether the gel that he had been using posed any health risks for patients. The reason it's been so difficult to get information about the PIP implants is that the owner of the factory, Monsieur Mas, has been arrested and charged, and it's now part of a legal process in France, and the French authorities haven't been releasing all the information that we needed in order to make our own assessment of the PIP problem. Patients find it quite confusing because France, for example, has recommended that all these implants be removed and it's prepared to pay for it. Germany has gone along with France but isn't prepared to pay for it. The UK has said you can have them out if you want to, but we don't recommend that you're taken out. And so this is all very confusing for patients. There was a lot of political pressure on the French government to make this decision, and they did make it just before Christmas in 2011. Other governments like the UK and Australia said, well, we need to get the evidence to make sure this is the right decision before we tell tens of thousands of women to have invasive surgery with its risks that may harm them. The fundamental problem with the PIP implants is that the manufacturer didn't use the medical grade silicone that was approved to be used on the manufacturing license. He used a cheaper version to save money. And that cheaper version of the silicone hadn't undergone the proper tests to ensure that it was safe for humans. We have to accept that because patients have got these implants in them, and it's a very worrying time for them. But the important thing now is to establish whether or not this cheaper gel is in fact safe or whether it does have health risks. Initially, concerns were raised about the PIP implants overseas because some surgeons felt that they were rupturing more frequently than other implants. Remember, all implants have a rupture rate. If we take, for example, the two biggest manufacturers of implants in the world, Allergan and Mentor, Allergan has a rupture rate of about 10% after 10 years, and Mentor has a rupture rate of about 13% after 8 years. So rupture itself isn't something extraordinary, but there was a feeling from some surgeons that the PIP implants were rupturing more frequently. Other surgeons didn't feel that, and that's what raised the concerns. Ultimately, this led to an investigation of the manufacturing facility, and then the French authorities discovered in March 2010 that the company had been using a gel that was different to the one it was supposed to be using. It's a common misconception that doctors were using PIP implants in Australia because they were cheap, but in fact that isn't true. They were a kind of mid-range price implant, and people used them because they felt that the dimensions of the implant and other qualities in the implant were going to suit their patient.